Welcome to this channel. Thank you for stopping by. Let me tell you a story. PD, a 32-year-old black woman, for the past 6 months has been having increased menstrual bleeding. Her period now lasts for 7 days, uses up to 5 sanitary pads per day as opposed to 3 she used to use. And at the end of 7 days, she becomes very weak, is unable to carry out her regular activities. When the symptoms come to a head, she goes to her family physician, who assesses her, sends her for an evaluation. The ultrasound scan comes back with the report that she has uterine fibroids. She's referred to the gynecologist, who counsels her for surgery, myomectomy. She has had the surgery and now she's fine. Uterine fibroids is quite common. It's something you may have heard. In fact, you have heard about it. It's quite common. This history I just painted, while it is hypothetical, it is the story of many women. Now, what is uterine fibroids? They are just abnormal growths from the uterus. Abnormal but non-cancerous growths, very important, from the uterus. What triggers the growth of this fibroids? We are not sure. But then, there are risk factors we have identified. Number 1, being black, like I've mentioned, is a risk factor for uterine fibroids. Number 2, being obese is a risk factor for uterine fibroids. Number 3, a quiet uterus, having not been pregnant, is a risk factor for uterine fibroids. Number 4, increasing age. The reports have it that by 50, 80% of women will have uterine fibroids. So increasing age is a risk factor for uterine fibroids. These conditions don't mean that once you're, in fact, like for instance, being black, it doesn't mean that all black women have uterine fibroids, but it is quite common. So if you have uterine fibroids, don't feel like, oh, it's my fault. What did I do? No. So don't feel like it's the end of the world or feel so drained and depressed. It's a common diagnosis. Now, how does fibroid present? It can be asymptomatic, without symptoms. We just find out that for another evaluation you were sent for another reason, uterine fibroid is found, but there are no symptoms. That happens and you don't have to worry. Number 2, it can also come up with abdominal swelling, abdominal pain, increased menstrual bleeding, which is quite common. Then there can be also pressure symptoms, what's referred to as pressure symptoms, causing increased urinary frequency, urinating often, finding difficult to poo, being constipated, and then some other non-specific symptoms. When you're having these symptoms, it's good to see your doctor, and then when a diagnosis is made, you'll be advised properly. So you don't need to be scared and worried. If you have been diagnosed with uterine fibroids, you may be asking, so how do I prevent it from growing? Uterine fibroids from growing. I mean, what did you do in the first place that made it grow or come up? So that's the emphasis here is like, it's not like there is a direct cause and effect and a direct prevention, so that you don't give yourself a lot of stress, mental stress. Some people have suggested diets, cutting off dairy products, processed food, processed meats. That is fine. There is no direct cause and effect between these things and uterine fibroid, but it helps for general well-being to eliminate this from your diet. So that is good enough. Also, weight loss. You can never go wrong losing weight. I mean, when you're overweight or obese, you can never go wrong. There are a lot of health benefits. So fibroids can be addressed medically with medicines or by surgery. So I'll make another video to talk about how fibroids can be addressed and treated. So meanwhile, see you in the next video. If you have any questions, please just drop them in the comments and I would always answer. Bye.